Hello and welcome back to Inside Update, a show brought to you by InsideInvestigator.org. We are a nonprofit newsroom working to root out corruption in the state of Connecticut through investigative journalism. And it's springtime, so you can probably hear the allergies in my voice. I hope everyone watching, reading, and listening is not faced with these allergy-related challenges. So I apologize for my nasaliness here. My name is Connor Dragotis. I'm the managing editor at InsideInvestigator.org. And today we're talking to Brandon Whiting, investigative journalist on our team, who has written his newest investigation about needs-based versus needless. That's just part of the title here. And it has to do with a 2,327% spike in unreturned IV drug needles. So this is obviously man, there's a lot to unpack here. I guess I think that I'll just say that up front. And Brandon, I'm gonna have you jump in right away. First, how are you? Welcome back. You were off last week, so we're just throwing you right back into the fire here.
That's typically how it goes with this business, so you just got to be used to it.
Absolutely. We're glad to have you back, and especially because uh, with this coming out, there is a lot of information in this. Just 30,000 foot level, though. Let's talk about what's going on. Not the spike, but just the landscape of the use of IV drug needles and I guess what changed in 2019.
So essentially, we received this tip from a property developer here in New Haven, and he took interest in this issue of needle litter because he obviously bought some properties and he's looking to renovate them, and he realized, damn, there is a lot of needles, used syringes around his properties. And he just started picking them up and picking them up, and they'd keep coming back and keep coming back. And so he questioned, why is this the case? What are the factors responsible for this? And he immediately kind of suspected some of the service, like addiction service providers in his community, and he realized that they were running SSPs, which are syringe services programs. And these programs, they operate at least ostensibly as syringe exchanges. So the idea is you bring in a syringe, a dirty used syringe, you'd get one back. And for about 20, probably over 20 years, because he started in the 90s, from their first SSPs in Connecticut in the early 1990s, I believe 93, up until around 2019, that was the case. You'd bring in one needle, you'd get one clean needle. And in 2019, the state went with what they call needs-based distribution, which is essentially do not limit, one for one. Do not limit the exchange of these needles to one for one. Listen to the users. How often do they shoot up a day? How many times do they shoot up in a week? How many needles do they say they need? Give them what they need. The idea being the more access to clean needles they have, the less risky behavior they'll be doing with these needles, such as reusing them, which can cause injury and infections, or sharing them, which can spread hepatitis C and HIV, which was a big problem, especially in the 90s. And while that sounds all good on paper, John here was like, okay, that sounds like a terrible idea in practice. And so he suspected that this was the culprit for this needle problem. So he went and he did some FOIAs with Demas that, well, the Demas ones he's waiting to get back. But the FOIAs, the information that we received was from the Department of Public Health. He's like, look, give me all the statistics, give me all the exchange rates. And he found that within the first year of them implementing the shift from one for one exchange to needs based distribution, there was a 2,327% spike in the amount of needles that were distributed and not returned. And so he's kind of just like, you know, is that not an issue? Is that not a problem? Obviously, it's reflected in the story. There's some diverging opinions from the people on the other side of the aisle who are, very pro harm reduction. So it was just interesting to see it from all angles and kind of like see, I guess, the dichotomy between, what people like John and other members of the community kind of see with their own eyes, and then what the literature essentially up until this point says, which is like the complete opposite. So it's Yeah.
I want to put some hard numbers to this as well, and I'll quote directly from your investigation. From 2011 to 2018, 114,693 distributed needles were not returned to SSPs. From 2019 to 2023, there were 2,487,747 unreturned needles. So, this is obviously a massive change. And, John, if I'm remembering correctly, without scrolling through the article live here on the recording, he started going for walks, right? I mean, he's walking around the neighborhood, and I think that's what he says really caught his eye is he's walking around the neighborhood and he's literally doing it with a bin, right? He's picking up needles and putting them away because he sees it as part of his community engagement. And I guess could you share with us a little bit more? My understanding is at some point he goes, what the heck's going on here? Let's start asking members of the community. And instead of going about it in a combative way, he kind of seeks partnerships. Is that a fair characterization?
I think there's an equal bit of both from what I can tell. He is
Okay.
a fiery individual. When as one of I believe it was Miguel Pittman, who's one of the community management team members. He had told me, he's like, I told John, he's like a pit bull. You set your eyes on something and you just won't let it go. And sure enough, I've seen some of the emails John has sent. Like he had like Mr. Jenkins of the Harm Reduction Alliance was very familiar with John, and he was like, he forwarded me some of the emails John sent him, and yeah, it was John certainly has a way with words if he has, So
All right, so
it depends on
maybe
which
I'm
side of
I'm
the aisle
viewing it
you're
with
on.
some rose-colored glasses here as well, because I think what you did, and you do this in your reporting a lot, which is that I think you see the best in people and you try to put forward their best. You're putting their best foot
Yes,
forward,
yes.
right? You want to
And I'm not, yeah,
sorry,
I
go ahead.
want to be
I
very
just wanted
clear.
to compliment your good faith efforts here. I'd not dismiss them out of hand.
I don't want to characterize John as like a bad person at all. I don't want him to see this and be like, Brandon, what the hell? No, like he he's just very passionate about this issue, and he has no problem if he feels like people aren't getting back to him or giving him the answers he wants to hear. He'll let you know what he thinks about it. And it even with the people that he has worked with here on the North Hill Community Management team. Both of them, they did not really get off to the best start with John just because he was the same way in trying to get his property plan by them. And they were like, geesh, throw us a little bit of a bone here. But yeah, he has made a significant partnership with these community leaders as around this issue. And as soon as he said that, as soon as he started bringing it up in meetings, they kind of everybody changed their tune and they were like, okay, well, this is one thing we can agree on. This is one common enemy of the community. And John himself kind of said, he's like, at first I saw this just as like a business investment, right? Like I bought these properties, I'm trying to flip them. Obviously, I'm looking at this from, a market perspective. But he's like, the more and more I've interacted with these community members and community leaders, I mean, the more and more I see how, this affects the everyday life and quality of life of the people who live here. Um, so that's one of the things that I think is most interesting about this issue in general, is because on the one hand, I can see why this decision was made at the state level, just from like a pure public health science standpoint.
Well, less HIV and less Hep C,
Exactly.
right?
Less HIV, less Hep C, and just giving, a traditionally, I mean, if you're an IV drug user, there's not a lot right going for you. There's not a lot of people in your corner. So trying to look out for the health of this kind of very marginalized community, I understand. But at the same time, there's also on the other end of it the people that live in these communities that are just trying to, raise their kids and not have to worry about open drug use, not have to worry about stepping on a needle, just trying to have a good quality environment. They're kind of just left thinking, well, what about us? And so I think ultimately it's going to be interesting to see just how both ends of the equation kind of work this thing out, because I don't see the state getting rid of this program anytime soon. Um, So yeah, that's kind of the dichotomy throughout the whole story that was just like interesting to me personally, I guess. You know me, I'm always kind of just I like seeing people's perspectives. So when you have the professors who's like, look, this is a public health thing that saved all of these lives. I mean, you do see it. Even John has admitted it. The SSPs have significantly reduced the rate of these diseases. But then on the other hand, you have the people who actually live in these communities and they're like, we're just tired of seeing people, nodding off in the grass while we're bringing our kids to school and dodging needles. It's
You
interesting, just
mentioned,
kind of the human element on both ends of it.
I mean, literally, like, needles in playgrounds was one of
Yep.
the things that was kind of a unifying moment or a unifying narrative for everyone. You don't want used or unused needles. You don't want sharp objects on playgrounds. Like, that's a very uh, reasonable expectation for a playground. But also, as you're walking around, whatever. What I don't want to spring this question on you, but I truly don't know or don't recall. Was there any discussion about use numbers? Because obviously we see like the number of syringes collected and distributed. You see this massive spike, right? That we talked about in just use generally, right? If I have this in front of me now, 600,000 syringes distributed in 2018, 1.1 million in 2019. Is there any indication that there's an increase in use that contributed to this as well, or is the argument it's this roughly the same number of individuals who are using, it's the number of syringes out there that's changed? Like, are there other factors that we should be aware of there, or was that not part of the FOIA or information that you gathered? Again, I realize I'm kind of throwing this at you. It just occurred to me.
So from what I've seen from the information that John has collected, there has been more over the years, there has been more and more clients that have signed up for these SSP services.
Okay.
Again, that's one of those things where it's like, okay, are there people who were signed up from 10 years ago that are still on the rolls that they just haven't wiped their names out? Like, is there some sort of evening out here? That we don't know, but it would appear as though these programs have taken on more clients in previous years. But again, that also too is kind of a rough metric because who's to, that's not everybody who's using drugs is going to feel comfortable going to a clinic, that I was just speaking with Mr. Jenkins of the Harm Reduction Alliance. I'd asked him, I was like, I understand there's an intake process here. As far as record keeping goes, how do you, like, what is the intake process for these clients? And he's like, look, so many of these people come in and they're just so wary of the entire process. They don't want to give us their name. They don't want to give us any information about them. It's these people feel like they're dealing with, the man, so to speak, a lot of them. So even if these numbers are increasing, there's still who knows how many other people who are using drugs and not using these services. I know that in the past, again, harm reduction literature, well, scientific literature used by harm reduction advocates has pointed to, these are not associated with higher rates of drug use. Um, I'm not a scientist, so, but I will say that that is what I have seen in some of previous research. But it's just everything involved with this. I think there's so many factors that it's kind of hard to just look at one thing and have a definitive answer. Like, is this leading to more drug use? I don't know that you could say definitively yes, but certainly when you're distributing more syringes, it can at least appear that way, right? There's
Well, yeah, I guess if I'm
floating around.
understanding correctly, yes, there are underlying arguments, but the reality and what you can say beyond a shadow of a doubt is there's been this massive increase in syringes lost, and
Yep,
it is being reflected in the fact that there are anecdotally more needles being left behind in the community. And
exactly.
correct me if I'm wrong, I mean, you went out in the community as well. Like, this isn't like you were just making phone calls and sending emails from your office. You went out. Now I know you have pictures in there, but you walked the streets just to get a feel for it as well.
John took me on the back of his golf cart, was explaining to me golf cart traffic laws in the gray area they inhabit here in the state of Connecticut. So that was very entertaining. But he took me to the common spots, and yeah, I saw with my own eyes. I mean, it's definitely a problem in the community. And I mean, I think the most damning picture that we took and that I included in the story is right across the street from the SSP. I mean, it's a place where it was obvious that people were using it to shoot up. There's used needles, used stoppers, to cap the syringes. And there was right there on the packaging a Connecticut Harm Reduction Alliance. I think it was an naloxone package, but it's like this is not where you want your branding to be found, unfortunately, if you're one of these organizations. And I think there is even the people who are pro harm reduction, they understand that this is an issue as well. They don't want it to point back directly at them. They'd say that, oh, well, there's other things we can be doing. It's about community, coming together, yada yada. But I don't. I think there's only so much level of denial that can be had. Certainly, whenever there's always going to be unintended consequences, no matter what your program is, no matter what bill you pass. And I mean, this is one where it's kind of just when you look at that return rate number and you look at what these people are seeing in the community, I mean, it's even if we don't have the research on the ground yet, it's kind of just like, all right, well, what are people supposed to conclude from this, right? It's clearly contributing to the issue. Yeah.
Well, even if it's just one, right? I mean, you're right about the branding, and it is nice, I guess, from that perspective. Like, again, anecdotal data, this isn't hard numbers, but if you're out there and you're saying, all right, hey, what I'm picking up, the litter I'm picking up, the trash I'm picking up, the dangerous objects I'm picking up are branded with the very company that's, made this policy change. It's hard, again, even if it's not being translated into hard numbers, that does have an impact on the community who's seeing this and developing their anecdotal assumptions of that. I just another quote that I saw because I have this picture and we'll have Joe put up that picture in this episode as well, so you can see that if you're watching on YouTube or CT Politics TV. The video version is available to you. But this says that Lockhart said that in 24 days, he and his assistant have picked up approximately 760 needles. So again, these are anecdotal numbers. These are, one guy's experience, but that's not an insignificant number for going around in less, just a couple weeks, really.
I've seen the bin. It is very filled with needles. Yeah, it's pretty
Is
gross.
the picture that we have at the start of the article like just like one of his bit like it's a lot, right? So does he have one like what does he do with these actually? I don't think that I recall reading about that. Is he just put them in a dumpster or is there a sharps disposal somewhere?
So there is a sharps disposal. There's numbers that you can call. I know a lot of like the Harm Reduction Alliance does offer to pick up in circumstances like this. If you give them a ring, they'll come and they'll pick these things up. I think the city also has to have a number, but I believe John at this point, I don't know if he's trying to fill the bin. That may take a little while. But I know he's trying to basically collect as many as possible just so when he finally can get a hold of the officials, I know it's reflected in the story that the management team was trying to get the Department of Health officials to come down as well as some City of New Haven officials to come down. And I do believe John was saving them for that meeting in particular, so he can kind of just very clearly illustrate the problem that syringe litter is posing in the community. Like, look here, you can't deny what I have in this bin. So how long he wants to keep that going for, I would have to check back in with him. But yeah, it's a serious amount of needles and not even just needles, other debris he's collected kind of associated with it. Like he had the
So
syringe program ID card of somebody. He's got empty methadone bottles as well. Um, so there's a significant amount of clutter beyond just the needles that's also associated with drug use and kind of drug services as well.
all right, so we have this problem, truly, needles on playgrounds, needles on the streets. Uh, this policy was put into place in 2019. Lay out for me what the potential solutions are. Is it getting rid of that 2019 policy? Is it supervised injection sites? Like, what are the SSPs saying? If anything, like, what are the different ideas here to, again, let's narrow it to this one thing, needles on playgrounds. What do people want to do?
So, if you would ask some of the members of the community management team, they would say just get rid of get rid of all of this. You know, we don't need methadone programs. We don't need these needle exchanges. Obviously, they're not doctors. They're rightfully pissed off community members. So I don't think you're going to get, doctors or CDC researchers to just say, okay, let's throw away these programs. So I think really what it's going to come down to is kind of cooperation between the community members and between these clinics. I know that in Maine they had considered getting rid of they had it at one for one distribution, and then they had switched it to needs-based distribution, I believe, during COVID. And there had been a lot of people writing in testimony. There was a bill they're trying to get passed this session to revert it back to one for one. And it's just like here, both sides of the aisle. You've got angry community members, and then you've got researchers and harm reduction advocates saying, no, you can't do this. So this is not an issue that is just here in Connecticut. I saw plenty of these kinds of disputes going around in various places in California as well. But one of the more novel solutions, I guess you could say, is there was a bill proposed this year. I believe it was also brought onto the floor 2 or 3 years ago, but it didn't pass then. And essentially, what it would do is it would legalize supervised injection sites. So, what that is, I mean, that's kind of like harm reduction taken to the craziest level, the most direct level, I suppose we'll say. And essentially, it would provide these supervised sites. So, if you are an IV drug user, you can go here. You're provided, a safe space to shoot up essentially. So if you overdose, there's nurses there that have naloxone, they have the clean needles. And when I was reading about that, I'm thinking, okay, wouldn't this be a good compromise, I suppose? Because from a harm reduction standpoint, I mean, you're never going to make a safer way for people to use drugs than literally putting them in a supervised environment with nurses, right? And then from the community standpoint, I mean, if there's people shooting up drugs in these like medical opium den type environments, for lack of better terminology, then that has to reduce the open drug use. That has to reduce the needle litter. So I was interested to see what people's opinions were on that. Like I said, the community members, they kind of just disagree with the idea of harm reduction in general. They're like, look, we should be trying to get people off of these drugs. We shouldn't be giving them the tools to do drugs. It's kind of like Miguel had described it as putting a band-aid on a wound that requires stitches. John, he was surprisingly kind of a little more open to the idea of harm reduction than I thought he maybe would be initially coming into this. He was just looking for more accountability measures. He's saying, there should be punishments for places that there needs to be identifiers put on these needles. There needs to be a punishment from the state, some sort of mechanism to prevent clinics that have terrible redistribution rates
Interesting.
from, you know, being able to follow needs-based distribution,
So you could
essentially.
track it back to where it came
Exactly.
from. Gotcha.
Uh, I was looking, because I went through so many different studies and research articles, and John, who is like practically a private investigator of his own on this issue, has sent me so many. So I was looking to cite it in the story, but I couldn't find it. But there are other states that have these programs that do just that, where they have unique identifiers on the syringes. So if you see litter in your neighborhood, you can be like, okay, well, I know this came from this clinic, and if I'm seeing 20 of these needles on the ground from this clinic, I know who to, pitch a fit to. So that certainly could be a solution as far as offering more accountability and just more traceability as to like, okay, what are the problem clinics? What are the ones that are not getting their needles redistributed to them? And then how do we solve this essentially? But as it stands, assuming there is no supervised injection sites, assuming the state doesn't want to throw away this program that it's had for 30 years, I think it's just going to come down to greater cooperation between the two sides of the aisle, essentially. All of the harm reduction advocate groups, they said, look, we don't, we know this reflects poorly upon us as well. We don't like it either. So they've offered, call our phone lines. We'll come, we'll pick it up. And they had also, Mr. Jenkins had mentioned the fact that, he had had a needle disposal contract with the city of New Haven, and this was technically their job to do all these cleanups and ship these sharps off. And then he basically lost the bid. It was given to Yale instead, and so they've been the one who's been doing it for the past few years. So that was another kind of part of the equation that these advocacy groups kind of mentioned to me is, look, it's not only on us too, it's on what resources the municipalities want to put into ensuring that the neighborhoods stay clean. So that's a lot to say. I said a lot to essentially say a little, and that there's a lot of different ways that this issue can be tackled. Um, it's just a matter of which one we're going to see, right? It's a matter of which one the state is going to be comfortable going through with. It's a matter of which one the cities feel comfortable going through with. And it's a matter of, if this is this big of an issue for these communities, how much of a fuss are they going to throw about it?
Let me ask you, you mentioned what the two parties would come to an agreement on. Let me also ask about the third party, which is those folks who are paying the bill
Yep.
for all of this to exist. Do you know, obviously, if we were to create the modern Connecticut opium den, as you have called it, then that would come with a significantly larger price tag. But do you know how much money from either your review of the 990s or other data, like how much are SSPs, how much taxpayer money is going into these annually? Do we know?
So I did ask, and I was surprised to hear that. Now, of course, these grants, I don't know how many of these grants are state funded grants, which is essentially would be taxpayer dollars, but they don't receive directly any taxpayer money for the operation of the SSPs. I do believe that they receive some modicum of supplies from the state as far as the syringes go. So obviously that would be paid for by taxpayer dollars. And they do operate on grants. I was told that some of them were state, some of them were federal. So again, depending on the mechanism of how these grants are funded, that would also lean back towards taxpayer dollars, right? As far as like straight up out of the general fund, this is the money allocated to you. They don't have any of that. So that would be, I guess that's another story we can look into, right? Really digging into the nonprofit funding here and trying to see. I know John had made a stink, more so raised an eyebrow because he had noted in the Harm Reduction Alliance's 990 that there was like an anonymous donation of, I believe, within the ballpark of $1 million. He's like, where's that coming from? Why don't they have to disclose that? So whenever you're looking into nonprofit funding, you know, you could get lost in the weeds with it. That's not where I went with this story. Perhaps I should have. But
Well, I mean, it's a vital topic. And listen, we're running out of time here because I think that we could talk about this because there are so many angles. And I'll put a bow on it to say, around that donor thing, like we fall in the same boat, right? I mean, we protect our sources. We're certainly not sharing, whistleblowers and tipsters information, but we also don't dox our donors in very much the same way. And we think that that's important because you shouldn't be compelled to support something that you don't believe in, but also, just because you donated doesn't mean that you should have your name splayed all over the place. There's a lot of reasons why people might not want their name attached to supporting SSPs, right? I hesitate to even list one because I think that they would be so diverse in their answers. Um, Anything else that you want people to know about this piece, other than, of course, go read the darn thing? But what else can we put out here before we wrap up?
I think mainly go just go read the darn thing. It was one of the more interesting pieces that I've done, I think, in a while. which I guess not to throw anything else under the bus. Everything I write, I love, okay? It's all equally interesting. But it's just because, it is just crazy to me, the dichotomy of these people who have done research on these things for years and the people who work in the field and then just the people who live in the community. And whether it is, as the harm reduction advocates would say, this is just like a difference in perception versus like empirical fact. Even if that's the case, that would very much show that there's a wide gap between the people who are out here, working at these SSPs, ostensibly feeling like they're serving the community, and the people who live in the community who look at these things and are like, please get the hell out of my neighborhood, And it's just, if that's the case, then how do you bridge that gap and how do you get both of these things to coexist peacefully if that is at all a possibility? And that's what I think is going to be interesting to keep an eye on in the future.
I think journalism is a wonderful way to go about bridging that divide and bringing it together. So credit to you for this piece. Thank you. Everyone should head over to insideinvestigator.org and check this thing out. Again, it is called Needs-Based or Needless, a 2,327% spike in unreturned IV drug needles. Check us out. This show is appearing on the radio, on YouTube, on CT Politics TV, Apple TV, Roku. It's all over the place, but the best place to get all of our work is insideinvestigator.org. We will be back in 2 weeks, and until then, be well, stay safe, and stay informed.